post-graduation, traveling by bus, I happened to meet a very successful physician. I asked him, what does he do? He said if he doesn't understand anything, he put the patient on antidepressant and the patient improves. It was very convincing. So most of the people at that point of our time thought that depression is a diagnosis of exclusion. If you do not understand anything, the patient must be depressed with a lot of somatic symptoms. But unfortunately, after 30 years, the scenario remains the same. I have lots of people who are orthopedic surgeons. When I talk to them, so if a person does not improve, their favorite antidepressant is duloxetine. And all specialties, they write it. So the question arises, is it a clinical depression? Or is it a depression normal? So diagnosing depression is not at all difficult. So depression as such is a normal emotion. All of us has experienced it one point of a time. I always tell my residents it's like a temperature. You have a 98, 99. The moment it crosses 100, it becomes a disorder. It becomes a sign to be cared for. Similarly, if the depression is persisting for more than 2 weeks, and it is interfering with your day-to-day activities, which normally as a psychiatrist we think we have 3 spheres of life. Personal, do you feel like getting up, dressed up, taking care of yourself? Interpersonal, are you attending to your social calls, your friends, your parents, your colleagues? Is the quality of the calls same? We all have a normalcy. When I call somebody, my call rarely goes beyond 1 minute, 47, 49 seconds. Everybody has his own periods. If it is shrinking or other way around, you have to be worried. Third area which we'll talk about is professional life. Whatever, you're a housewife, your quality of work has gone down. You don't prepare the cup of tea as good as you used to. If you're students, your grades have started deteriorating. If you are a doctor, we get irritated. Anybody. So if any of these spheres, personal, interpersonal and vocational, is affected for more than 2 weeks, it is a clinical depression. So this is one of the reasons of dying by suicide. I am not using word committing suicide or attempting suicide, because we do not attempt stroke, we do not attempt heart attack or a myocardial infarction. It just happens. Suicide also happens that way. So once we say we are dying by suicide, not attempting, that means we are taking away the stigma out of it. So my first appeal to my students is this, that we will never use this word again, attempting suicide. He died by suicide, he died by stroke, he died by heart attack or some other failure. So stigma has to go. So second comes, we talk about depression. Depression is of grossly 2 kinds. Endogenous, where you have a causes. Endogenous, where you don't have any causes. Whatever we talked about here, it was all about exogenous. We did not talk about endogenous. And most of us do not know what is endogenous. Person wants to take his life, but he doesn't know why. He doesn't want to live. He sees everything black, gray. But if you ask him, he's nothing to talk. So listening was more important for exogenous. Endogenous, you have to be with the patient. So first cause of suicide is depression. The second is schizophrenia. The person is not going to talk to you. Third is drug abuse. Alcohol, we all know. And then fourth is personality disorders. You have either one or combination of all these. So diagnosing depression exogenous type is very, very easy, but there are other 3.5 things which we're not talking about. So just stay with the patient. If need be, it's very, very easy to diagnose as a medical personnel. We call them weirdo schizophrenics. Many times I see schizophrenic. I remember one of my patients from a common college, Patiala. The girl was telling his father that boys are following her. Father beat up the boys, lost a complaint, went to his home. The boy's father also beat him up. The boy said, and the friend said, we never saw that girl ever. We have nothing to do, but no one listened to them. So presumptions, we do not listen to the people around. So we have to listen to them. After about 3 years, he went to PGI and those guys said, she was schizophrenic. What the hell you were doing for all the 3 years? And now, once you have illness of 3.5 years, the prognosis becomes poorer and poorer. So, today's job by the Department of Psychiatry is to make you aware not only about depression, which you already know. Exogenous depression, you know. We have endogenous depression, schizophrenia, drug abuse, and talking a little bit about drug abuse. About 40% of the people, once they reach an emergency room, parents do not know. They are not willing to believe that their kid, the son or a daughter, we have a female de-addiction ward here. This is for your information. We could never ask anybody. In 2000, if I had to ask a female, does she drink? My throat will choke. And if I have to ask any Sardar that does he smoke, the same thing will happen. No, it doesn't. I ask as if she has taken meals. Ma'am, do you drink? Yes, sir. How much? Sir, whenever in the parties. How frequently the parties are? Sir, 3-4 days a week. So we are trying to compete with the men here. So drug abuse is one of the reasons why we do not ask. We keep shying asking the girls. Okay, do they drink? Now I've come to know from a resident, the person who does not drink is a backward. They probably bully the person who doesn't drink. It used to happen 20 years back, other way around. So this is where we are progressing. This is where we are leading ahead with the increase in the suicidal rates and other things. So going for the last, this slogan, action through hope. So the first job is, once you diagnose a person, stay with the patient. If you feel that person has some kind of a disorder, take him to the concerned professional. Thank you so much.
Speakers for the day, our very respected Shri Prem Gupta ji, the Secretary of our Managing Society. I think you are a relatively younger batch, so you might not have met or seen Mr. Prem Gupta very frequently. He is a pillar for the institution. He is the driving force for the institution. And whatever this new campus that you're seeing over here, you haven't seen the old one. If you talk to your colleagues who was about 5-6 years senior to you, they'll tell you in which kind of classrooms they studied. Besides that, I'm just coming to the day-to-day. Okay, I'll first complete the formalities. Dr. Sandeep Kaushal, the Dean Academics, Dr. Franji Mahajan, the Head of Psychiatry, the other faculty members from Psychiatry Department, and all my other colleagues from the faculty and their students. So we are here on a day, the Suicide Prevention Day. थोड़े दिन पहले किसी ने मेरे को फोन किया जी आज हम वर्ल्ड एड्स डे सेलिब्रेट कर रहे हैं तो आपका एक वो बाइट चाहिए मैं क्या आप सेलिब्रेट क्यों कर रहे हो व्हाट इज देयर टू सेलिब्रेट सो वी एक्चुअली commemorate the day. There's nothing to celebrate. It's just something to create an awareness. We'll talk about it. We'll gain knowledge about it. Now the day-to-day is suicide prevention. I'm lucky to have a management which is very supportive, to have a faculty which is neither vindictive nor sadistic. That becomes the most important asset for any head of the institution. Because जो students में रोष आता है, वो तब आता है जब कोई teacher vindictive हो, sadistic हो. Strict होना acceptable, discipline maintain करना जरूरी है. But I am lucky that I have got strict, disciplined teachers. They might be a little harsh on the students, but they are neither vindictive nor sadistic. So इससे मेरी टेंशन कम हो जाती है. Because I still remember जब हम psychiatry की क्लास में बैठते थे तो जो हमारे psychiatry के प्रोफेसर हैं वो पूछते थे कि भी आप में से किस किस को सुसाइड का आइडिया कभी आया, और 50 की हमारा बैच होता था, and out of 50 at least 40 used to raise their hand. So he said that it's very common. You feel the word which Ranjeev was using, depressed. I mean, depression can be momentary also. And once that feeling is there, and at that time you feel कि भी जी कर क्या करेंगे. और जब आप एज ग्रुप में हो, वो गर्लफ्रेंड बॉयफ्रेंड वाला सिलसिला चलता है, उसमें एक और एंगल आ जाता है. So you've heard, I would say, lecture or the facts and myths about suicide prevention that Dr. Ranjeev talked to you about. But the idea about this is for you to percolate it further. We've got a suicide prevention hotline. I think you started that a couple of years back. So there is a number which is there. I'm not saying that you need to use that number at any time, but you need to inform people that in case they have any problems, they can use it. We as physicians, we come in contact with patients who have attempted suicide and they land up in the hospital. And if I can start recalling the flimsy circumstances over which any person could commit. I still remember two brothers, they had a fight. एक नया मोटरसाइकिल लेके आए थे घर में, वो कहता मैंने पहले चलाना है, वो कहता मैंने पहले चलाना. तो जिसको पहले चलाने को मिल गया, दूसरे ने suicide attempt कर ली, and he landed up with us. So I'm just talking about how that moment, when that thought comes, and you react to it, and you give in to it. So the best thing is, अगर आपके पेरेंट्स आपको डांट रहे हैं, अगर आपका टीचर आपको डांट रहा है, just take it cool. अगर आपकी किसी से लड़ाई हो गई है, just take it cool. Don't feel offended. Whenever I'm stressed, I तो chat the Gayatri mantra. I'm not talking about the suicidal thought, I don't get it, but so it takes away. So this is a similar process that one can follow, and as students of this college, as students of this great institution, we've been ranking very well. Yesterday the National Institute for Reference rankings were released. We were placed again at number 26 out of more than 500 institutions across this country. We are the only medical college in that list at number 26 from North India. There is no other college from North India. There are about, yes, PGI Chandigarh is there, but I consider that not a medical college, it's a different institution. In India today again, we had a better ranking than last year. And all this is because of a concerted effort. Mr. Prem Gupta, the kind of time and dedication with which he has worked to get this institute in this level, all the faculty members, and of course, we've got a good set of students who come over here. They don't trouble us, they don't create nuisances. So all this leads to the progressive growth of this institution. So my only parting advice to you all is that fortunately over here, all faculty, all administration, आप सबको फोन करोगे, अगर उनका नंबर होगा, he'll pick your phone up at 12 o'clock at night. He's the secretary of the managing society. आप मेरे को करोगे, I'll pick it up. So you've got good mentors, good caretakers. So if any one of you or your friends or your family is in a problem at any time, you're most welcome to contact us and take care of yourself. So I'll thank you all for coming over here. I'll thank our Secretary Sir also for sparing his valuable time, and I'll compliment the Department of Psychiatry for holding this event, and I'm sure that it will help someone at least. Thank you so much.